Hello friends, welcome back to our YouTube channel. In today's video, I will be discussing about complications that are related to mechanical ventilator and VAP Care Bundle in detail. Before that, you have not watched our video on ventilator, make sure to watch it. The link is in description box. So without any delay, let's get started. Complication of mechanical ventilation. We can broadly divide this into two categories. One is ventilator induced lung injury and another one is ventilator associated pneumonia. This ventilator induced lung injury includes athlete trauma, barrow trauma, valve trauma, and complications that are related to high PEEP. Okay, first one is athlete trauma. It is also known as cyclic athletasis. On patient and mechanical ventilation, the ventilator will provide inspiratory and expiratory pressures, right? So this pressure will open and closing the alveoli. So repetitive opening and closing of alveoli without any break. This will result in athlete trauma. Barrow trauma. This barrow trauma is caused by high inflation lung pressure. This high inflation lung pressure will increase the pressure within the thoracic compartment. This will result in air leakage within the surrounding lung tissues. Okay, and this potentially leads to conditions like pneumothorax. The mnemonic is BPP. Here B stands for barotrauma, P stands for popped lung. That means pneumothorax. Okay, barotrauma will result in pneumothorax. And next one is valve trauma. This valve trauma is caused by high tidal volume. In patient and mechanical ventilation, when there is increased high tidal volume, this will overstretch or overdistend the alveoli. This results in lung damage. Okay, that's why conditions like ARDS, in which compliance is poor, we need precise control over pressure, or this can result in valve trauma. Okay, the memory trick is value trauma. Think of high tidal volume. Okay. Complications that are related to high PEEP. This high PEEP will result in hypotension. How this cause hypotension? Because this increased PEEP will increase the pressures within the thoracic compartment. This increased pressures will compress the blood vessels within the lung tissues. This will eventually result in reduced venous return to the heart. This results in hypotension. Okay. And ventilator associated pneumonia. It is defined as occurrence of pneumonia after 48 hours of intubation. Okay. To diagnose this ventilator associated pneumonia, we have some criteria. Those are new onset pyrexia, purulent sputum, leukocytosis or leukopenia, and decreased in oxygenation. And another one important is radiographic presentation of new lung infiltration. This VAP can be early onset or late onset. This early onset VAP can be occurs within first 96 of mechanical ventilation, whereas this late onset manifests beyond the first 96 hours of ventilation. Okay. To diagnose ventilator associated pneumonia, we have one scoring scale, that is clinical pulmonary infection score. It is a tool that consists with features that are to diagnose VAP. Okay. The treatment for VAP includes three components. Those are antibiotic therapy, supportive care, and infection control. This antibiotic therapy, the typical course of antibiotic therapy for VAP is around 7 days, but it can be individualized. Okay, and supportive therapy. It includes respiratory support, oral hygiene, and nutritional therapy, and chest physiotherapy. And infection control, the nurse should maintain strict hand hygiene and should suction within a closed suction system. Okay, this will prevent the infection. So, to prevent VAP, we have VAP Care Bundle. This VAP Care Bundle includes five key components. Those are head of the bed elevation, sedation vacation, peptic ulcer disease prophylaxis, DVT prophylaxis, and oral hygiene with chlorhexidine. Head of the bed elevation. Usually, patient on mechanical ventilation lies supine, right? So, the supine position can lead to aspiration of stomach content into the lungs. So, in order to prevent this aspiration, we have to elevate the head of the bed into semi-recumbent position. Okay. Next, sedation vacation. The physician will daily instruct the patient from sedation in order to assess the readiness of extubation because early extubation will reduce the risk for VAP, right? And peptic ulcer disease prophylaxis. Usually, patient and mechanical ventilation have stress and he may be on many other medications. Okay, this will eventually result in peptic ulcer on stomach and the intestine. In order to prevent this, we have to administer peptic ulcer disease prophylaxis. Deep vein thrombosis prophylaxis. We all know that the patient on mechanical ventilation are immobilized. This immobilization is the one of the risk factor for getting DVT, right? So, in order to prevent this DVT, we have to administer DVT prophylaxis. And last one is oral care with chlorhexidine. Usually, patient and mechanical ventilation have increased risk for respiratory tract infection. In order to prevent the respiratory tract infection, we have to provide daily oral hygiene with chlorhexidine solution twice a day. Okay. So, to remember these key components of the VAP Care Bundle, I have come up with the mnemonic. The mnemonic is SHOP D. Here, S stands for sedation vacation, H stands for head of the bed elevation, O stands for oral hygiene with chlorhexidine, and P stands for peptic ulcer disease prophylaxis, and D stands for DVT prophylaxis. And other measures to prevent ventilator associated pneumonia is too early subclinic suction. Suction using closed suction system above vocal cord will prevent the infectious material to get trapped or aspiration into the lungs. And for early cup pressure monitor. Usually the cup pressure is set between 20 to 30 centimeter of water in order to prevent the air leakage within the lung tissues and surrounding areas. So that's all about it. Complication of mechanical ventilation and VAP Care Bundle. If you found this video helpful, share this video to your friends who are preparing for examination. To download flashcard, follow us on WhatsApp channel and to attend daily quiz, follow us on Telegram group. Thank you friends.